Okay, now we're going to apply what we call McConnell taping to the knee. Now, this tape can cover a variety of conditions, and it helps by assisting the kneecap to track towards the inside, because with a lot of these conditions the kneecap tracks too far towards the outside, which puts stress on different structures within the knee. So we initially start the tape with an under tape. Don't necessarily need to use this, but I apply it a little bit more towards the inside than the outside. And the kneecap being there, I apply that first strap in the top half of the kneecap. With this technique I'm using, this V underneath the knee, it's not used all the time, but it unloads a structure underneath the kneecap called a fat pad. And it can be very useful with this taping, and that's what I'm going to do in this case. Once again, this Fixamol is purely a tape that helps protect the skin. And the actual Luca tape, which I'll be using next, actually does the strapping and controls the movement. So I just apply that V underneath the kneecap. Now next I'm going to be using Luca tape, and if you're not sure of how long to use it, just measure it upside down first, and I'm just going to cut that off. We start by sticking it on the outside of the knee, and we apply some pressure medially or towards the inside. Just maintain it, doesn't need to be too firm. We hold that down the whole time. Then I'm going to reinforce that tape once again, starting on the outside, pulling towards the inside. I usually stabilise the kneecap, and you can see the kneecap's wrinkled on the inside, which means that that force is pulling medially or towards the inside, which is what we're trying to achieve. So those two straps are going to control the patella. This strap here is going to unload the fat pad. So we basically push the soft tissue out of the way, apply the tape underneath. It's a little long, so I'm just going to trim that. Just stick that down, and I'm going to do the same on the other side. Start on the outside. I'll just cut that length to the right amount. Once again, I'm going to pull the soft tissue back. I'm going to stick that down, and then basically if you just let your knee relax, the knee will be a little bit squishy underneath there, and we've unloaded the fat pad. And the reality is it doesn't matter who it is, everyone has a fat pad. A lot of female clients get upset about that, but it's a normal structure which causes kneecap pain, and we're unloading that. But that's McConnell taping with a fat pad release.